That's a good bunch of folks we got here in Ohio, working hard. Which is why I'm glad to be back, and let's face it, it's nice to be out of Washington once in a while. I want to thank Connie. I want to thank Connie who introduced me. I want to thank her and her family for being here on behalf of her sister, Natoma. I don't know if everybody understood that Natoma's in the hospital right now. So Connie was filling in. It's not easy to share such a personal story when your sister, who you love so much, is sick. And so I appreciate Connie being willing to do so here today. And I want everybody to understand that Connie and her sister are the reason that I'm here today. See, Connie felt it was important that her sister's story be told. But I want to just repeat what happened here. Last month, I got a letter from Connie's sister, Natoma. She's self-employed. She's trying to make ends meet. And for years, she's done the responsible thing, just like most of you have. She bought insurance. She didn't have a big employer who provided her insurance, so she bought her health insurance through the individual market. And it was important for her to have insurance because 16 years ago, she was diagnosed with a treatable form of cancer. And even though she had been cancer-free for more than a decade, the insurance companies kept on jacking up her rates year after year. So she increased her out-of-pocket expenses. She raised her deductible. She did everything she could to maintain her health insurance that would be there just in case she got sick, because she figured she didn't want to be in a position where if she did get sick, somebody else would have to pick up the tab, that she'd have to go to the emergency room, that the costs would be shifted onto folks through their higher insurance premiums or hospitals charging higher rates. So she tried to do the right thing. And she upped her deductible last year to the minimum, the highest possible deductible. But despite that, Natoma's insurance company raised her premiums by more than 25%. And over the past year, she paid more than $6,000 in monthly premiums. She paid more than $4,000 in out-of-pocket medical costs for co-pays and medical care and prescriptions. So altogether, this woman paid $10,000 1 year. But because she never hit her deductible, her insurance company only spent $900 on her care. All right, so the insurance company is getting $10,000, paying out $900. Now, what comes in the mail at the end of last year? It's a letter telling Natoma that her premiums would go up again by more than 40%. So here's what happens. She just couldn't afford it. She didn't have the money. She realized that if she paid those health insurance premiums that had been jacked up by 40%, she couldn't make her mortgage. And despite her desire to keep her coverage, despite her fears that she would get sick and lose the home that her parents built, she finally surrendered. She finally gave up her health insurance. She stopped paying it. She couldn't make ends meet. So January was her last month of being insured. Like so many responsible Americans, folks who work hard every day, who try to do the right thing, she was forced to hang her fortunes on chance. Just to take a chance, that's all she could do. She hoped against hope that she would stay healthy. She feared terribly that she might not stay healthy. That was the letter that I read to the insurance companies, including the person responsible for raising her rates. Now, I understand Natoma was pretty surprised when she found out that I'd read it to these CEOs. But I thought it was important for them to understand the human dimensions of this problem. Her rates had been hiked more than 40%. This was less than 2 weeks ago. Unfortunately, Natoma's worst fears were realized. And just last week, she was working on a nearby farm, walking outside, apparently chasing after a cow, when she collapsed. And she was rushed to the hospital. She was very sick. She needed 2 blood transfusions. Doctors performed a battery of tests, and on Saturday, Natoma was diagnosed with leukemia. Now, the reason Natoma is not here today is that she's lying in a hospital bed, suddenly faced with this emergency, suddenly faced with the fight of her life. She expects to face more than a month of aggressive chemotherapy. She's racked with worry not only about her illness, but about the costs of the tests and the treatment that she's surely going to need to beat it. So you want to know why I'm here, Ohio? I'm here because of Natoma. I'm here because of the countless others who've been forced to face the most terrifying challenges in their lives with the added burden of medical bills they can't pay. I don't think that's right. Neither do you. That's why we need health insurance right now. Health insurance reform right now. I'm here because of my own mother's story. She died of cancer, and in the last 6 months of her life, she was on the phone in her hospital room arguing with insurance companies instead of focusing on getting well and spending time with her family. I'm here because of the millions who are denied coverage because of pre-existing conditions or dropped from coverage when they get sick. I'm here because of the small businesses who are forced to choose between health care and hiring. I'm here because of the seniors unable to afford the prescriptions that they need. I'm here because of the folks seeing their premiums go up 20 and 30 and 40 and 50 and 60% in a year. Ohio, I am here because that is not the America I believe in. And that's not the America that you believe in. So when you hear people say, start over, I want you to think about Natoma. When you hear people saying that this isn't the right time, you think about what she's going through. When you hear people talk about, well, what does this mean for the Democrats? What does this mean for the Republicans? I don't know how the polls are doing. When you hear people more worried about the politics of it than what's right and what's wrong, I want you to think about Natoma and the millions of people all across this country who are looking for some help and looking for some relief. That's why we need health insurance reform right now. You know, part of what makes this issue difficult is most of us do have health insurance. We still do. And so we kind of feel like, well, I don't know, it's kind of working for me. I'm not worrying too much. But what we have to understand is that what's happened in Natoma, there but for the grace of God, go any one of us. Anybody here, if you lost your job right now, and after the Cobra ran out, looks like we got somebody who might have fainted down there, so if we got a medic. No, hold on. I'm talking about there's somebody who might have fainted right down here, so.